It's a highly contagious airborne illness that can cause rash, fever, red eyes, and cough. Severe cases of measles can also cause blindness, pneumonia, or swelling of the brain, and in some cases, death.
We're seeing these sporadic outbreaks of measles.
Dr. Daniel Koritzkis with Brigham and Women's Hospital says most of the measles illnesses now popping up in the U.S. are in young children. Last year, 285 cases were reported to the CDC. That's the most since 2019. And this year, cases are already emerging in several states. Experts say it's due to lower vaccination rates from misinformation. In Texas, there's an outbreak with at least 24 cases, and state health officials say that number is growing.
The vast majority are happening in people who have either not been vaccinated or whose vaccination status is unknown.
Koritzkis says the best protection against measles is vaccination. The first dose is typically given to children between 12 and 15 months, with a second dose administered around age 4. The CDC says older children and adults can also get vaccinated if they didn't receive the vaccine as a child. And the agency says if you were vaccinated with the first version of the measles vaccine used between 1963 and 1968, or don't know which type of vaccine you received, you should get at least one dose of the current measles vaccine.
People should just make sure that they are up to date with their measles vaccination and that their children are up to date.
For Health Minute, I'm Mandy Gaither.
There's a measles outbreak in Texas and New Mexico. Now, Texas health leaders say this is the biggest outbreak in that state in nearly 30 years. As of right now, no cases in Tennessee, according to the Department of Health.
So to talk a little bit more about this, we're joined by Dr. William Schaffner at Vanderbilt University Medical Center to talk about the potential for concerns right here in Tennessee. Dr. Schaffner, good morning, sir. What are the common misconceptions about the measles?
Well, the most common misconception is, of course, that this is just a trivial infection. It creates a rash and then everybody gets better. But of course, that's not true. These children get very, very sick for at least a week, and there are serious complications. You can have middle ear infections, pneumonia, and 1 in 1,000 children get encephalitis. In this outbreak in Texas, there are over 13 children already hospitalized. So you'd want to make sure that your child is vaccinated. If your child has not been vaccinated against measles, please take them to your pediatrician or family doctor and get the vaccine.
Now, Dr. Schaffner, though, there are a lot of parents who have been hesitant with vaccines of late. So are there any other ways to stay safe and prevent that disease?
Well, I think prevention relies on vaccination. Otherwise, you're susceptible. This virus can be imported from abroad, find you here, and cause infection here, and you'll spread it to your playmates and to your schoolmates, who also, some of them, have not been vaccinated. Talk to your doctor, talk to your pediatrician and family doctor if you have any concerns about measles vaccine. You know, before we had vaccine in the United States, 400 to 500 children died each year of measles and its complications. The number now is 0. We want to keep it that way.
All right, Dr. William Schaffner, thank you so much, sir. We appreciate you joining us there from Vanderbilt University Medical Center.
Thank you.
Tonight's top story, the measles. Metro Health is warning anyone that may have come in contact with a visitor from West Texas to monitor themselves for symptoms. The visitor was in town on February 15th and visited the UTSA main campus, the Riverwalk, and Mr. Krabby's Seafood in Live Oak. They also made a stop at Buc-ee's in New Braunfels on the 16th. Dr. Pedro Chavez with North Central Baptist says the only way to protect yourself is to get vaccinated.
You can wash your hands all you want, you can wear anything, but this disease is so contagious that only vaccination can prevent it.
It can take up to 2 weeks for a person who's been infected to show symptoms. Doctors say people who have come across the visitor who tested positive will likely start feeling symptoms soon. Here's something important to note. While the vaccine is not guaranteed to keep you from getting the measles, the efficacy rate for 1 dose is 93%, which is given to infants. The second dose, given to kids around 4 years old, is about 97% effective. If you're vaccinated and catch it, doctors say your symptoms will be much less severe.
That local case of possible measles exposure has some parents wondering if their kids are safe at school. While public schools require students to be vaccinated, some claim exemptions. News 4 San Antonio's Karina Hollingsworth breaks down the numbers here.
Texas law allows for exemptions from immunizations for reasons of conscience, including religious belief. This 2023-2024 Texas Annual Report of Immunization Status shows private schools have a higher rate of unvaccinated students. In Bexar County, 14.69% of students at Buckner Fanning School at Mission Spring are unvaccinated. And in Como County, 30.98% of Bracken Christian School students are unvaccinated. Joseph Canty, UT Health San Antonio's Associate Professor of Pediatrics, says vaccinating your children is the best thing you can do for them.
People who are anti-vaccine or vaccine hesitant are generally doing it because they're not sure what the best thing for their own children is, and maybe they're getting information from sources that don't always have their best interests at heart.
Brianna Avila is expecting her first child, and she says she chooses not to vaccinate.
Unvaccinated children, they're most likely to gather it, let it run through their system, and it will most likely not have an issue coming up again in the future.
While most unvaccinated students attend private schools, there is still a percentage of unvaccinated students who attend public schools. We reached out to area districts, and only San Antonio ISD responded with a statement in part. We are adhering to our fever-free guidelines. Notices will be distributed if a diagnosed case has been identified on campus. For more on the measles, including symptoms and treatment, please go to news4sanantonio.com. Reporting for News 4 San Antonio, I'm Karina Hollingsworth.
The person who visited UTSA also took a trip to Buc-ee's. So now Comal County is on high alert. News 4 San Antonio's Ethan Trejo spoke with the county about their concerns.
Well, Comal County officials informed me that right behind me at the I-35 location of Buc-ee's here in New Braunfels was where that Gaines County resident visited while they were in the area. They came on February 16th, anywhere between 9 a.m. and 12 p.m. But now Comal County is just urging residents to be cautious.
The thing about the measles virus is it is airborne, so it does stay in the air for up to 2 hours after the person leaves.
Cheryl Fraser is the director of public health for Comal County. So far, she says the county isn't aware of any other possible cases, but that's why they want the public to be extra cautious of possible exposure.
That's the reason we put from 9 to 12, because anybody that was in the store from 9 to 12 could have been exposed. We have reached out to Buc-ee's, and we are going to monitor the employees there that were in the store between those hours also.
Fraser says that it's important to remind residents who haven't been exposed to receive their vaccinations, and for those who believe they have, to remain calm and reach out.
We want to protect the community and, ask people to please stay away from the ER. As always, that's the worst place you could go if you think you've been exposed, because then you're exposing even more people.
She also reminds residents who may suspect they are infected that they are required by law to notify officials as soon as they can. For anyone with questions, you're encouraged to call Comal County Public Health at 1-830-221-1150.
We highly encourage people to call us. It doesn't hurt to call.
Ethan Trejo, News 4, San Antonio.
And this all leads to our question of the day.
One of the world's most contagious diseases is once again surging across the country. Health officials say a measles outbreak has already sickened dozens of people in Texas and New Mexico since late January. Now, 2 universities in the Lone Star State are warning about potential exposure after giving campus tours to at least one person who tested positive for the virus.
If you're in the same room as the individual or proximity to them, say for instance, if the same tour group, same sitting area of the restaurant, then we want individuals to be very aware.
The CDC says infections have also been reported in at least 6 other states. 25% of the cases so far this year have resulted in hospitalizations. And with kindergarten vaccination rates dipping nationwide, more communities may be at risk of outbreaks.
I think that this is going to get into the hundreds of cases and could take many months to try to fully snuff out. And when you have that kind of a concentration of measles within a community, it's going to inevitably spread outside that community.
While there is no specific treatment for measles, public health officials say getting vaccinated remains the best way to protect yourself. 2 doses of the vaccine are about 97% effective at preventing the virus.
If you walk into a room where measles was 2 hours ago and you're unvaccinated, there's a 90% chance you're going to get it.
The CDC says the disease is most dangerous to children under 5 years old, and it can cause a rash, cough, and high fever. In Washington, Jared Halpern, Fox News.